I think we will go ahead because we've got an awful lot of things to cover here in the next hour, and judging from the response of everyone, there was great interest in this topic. So I'd like to begin by welcoming you for this chat with Chat. Our host is Dr. Chat, and we're really happy that you're here. If you be sure to mute yourself, if you're not already muted, that'd be great. And just as a reminder here for Zoom, we probably all know by now, but there is a button at the bottom of your screen, usually located, looks like a little bubble thought question, and that's where you click on to enter your questions. We will do our best to get to your questions now, but if not, I'll be sharing with you other ways you can submit your questions as well. So again, I'd like to welcome you. I'm Laura Koliskowski. I'm directly connected with iConquer-MS because I have multiple sclerosis, and it's a topic that is dear to me, and I'm sure of interest to all of you. That's why you're giving up this afternoon to be with us. There's a few projects that we're doing with iConquer-MS that I'd like to cover briefly, just to remind you, because it's been easy to forget over the summertime. There are activities still going on in the background that we need to get caught up with come fall. First of all, I want to really urge you to check your data on your iConquer-MS dashboard to be sure that you've joined iConquer-MS and you've joined the COVID-19 study for COVID and MS study. I want to just give you a quick view of some of the information we've gathered, and I just pulled this yesterday, that to date we have 1,594 enrolled participants. But if you notice, the number of people who have registered their first vaccine dose declined, and then the second vaccine dose went down again. And I know many of us have that third, fourth, and fifth dose. So be sure to get online and update your information. If you've not joined COVER-MS, and this study is really important, please feel free to join at any time. New enrollees are welcome. And some of the information we're gathering, well, everything that we're gathering through COVER-MS is available live on your dashboard. And I just wanted to give you a quick screenshot of what it might look like when you go and look, say, at vaccine reactions to dose 1. So you can see the various ones, and I know it's really tiny print, but if you sign up through your dashboard, you can see this in a larger scale. Lots of information that's very interesting if you're very interested to look at if you're interested in research. The other project we have going on is Real MS, and Real MS is our longitudinal study about research engagement about life with MS, and it started back in 2015. And again, I've given you a sample of my data. You may not know it if you belong to Real MS and iConquer-MS, that you can look back at all of your data that you have entered, and it's all live. So right now, as of last night, I pulled up again a graph showing just the demographics of the people who are involved with Real MS currently. And you can see it broken down by sex and also by age in that first graph. And then the graph on the right, I wanted to share with you, you can access your personal data in a way that we really haven't promoted a whole lot yet, but we're happy to walk you through it. All of your entries that you've made on your surveys are now available in graph form, and you could print these out and use them for your own records or take them to your next care provider appointments. What you're looking at right there is my fatigue graph from 2015 up until now. So be sure to go in and look at that. And while you're there, be sure to complete the Real MS study items that are there. And the key point to Real MS also is, this is how we find participants to participate in additional activities for our work that we do with research, especially like with what Dr. Minden's going to be talking about. We found those people through our Real MS cohort. So be sure to sign up if you're not already involved with us. And then the final thing I mentioned, you'll have a chance to enter questions during our chat today, but also you may have questions that are really burning in you that you think you'd like to have us look at more in depth, closer. And one of the features of our dashboard, again, is the Our Questions Have Power program, and it's participant-driven research. You think of a question, we post it up there onto our platform. We give the community, the people who are enrolled in iConquer-MS, the opportunity to vote the topic, the question up or down as far as having priority and of interest. So it's really important that you submit your questions there, and then we'll go off and find researchers who perhaps will have that same interest to be able to collaborate with us. So those are three really important things: cover MS for the COVID study, real MS for longitudinal study, and then our questions have power program. And with that, I know you didn't come here to hear me talk about this. You really came to hear about our complementary and alternative medicine program. And I'm going to turn this over to, I believe, Surajat, who's going to introduce our speaker for today.
Hello, everyone. Oops. Oh, okay. Hello, everyone. First of all, thank you so much for being here today. And for those of you who hasn't been here before, this webinar named Chat with Chat, because my name is actually Surajat and I go by Chat. So that's why it becomes Chat with Chat. So, but as we indicated when you register, if you are comfortable just to listen, you are more than welcome to do so. But before I introduce our speaker today, and just like to let you know that our speaker will spend about like 40 minutes to have her presentation. And then we're going to exercise questions. But if you have questions and you want to type it in chat, we have Holly Schmidt to monitor those questions as well. Okay. So without further ado, let me introduce, today I am very honored to introduce Dr. Sarah Minden. She's a psychiatrist who has worked with the individual with MS and their family members for over 40 years to evaluate and diagnose, treat mood disorder and also other mental illnesses and challenging life circumstances. She led the team that developed the evidence-based guideline on psychiatric disorder in MS and also contributed her clinical experience on mood and cognitive disorder through scientific publications and also educational materials for clinicians, patients, and families. Sarah's most recent research has focused on health services, also policy studies that combine analysis of quantitative data from survey and claims database, and analysis of the qualitative data from in-depth interview and focus groups. Sarah is a principal investigator of the Sonia Slipka longitudinal multiple sclerosis study that follow a population-based sample individual with MS in the US from year 2000 to 2010. So to learn more about the types and costs of health and home care services people with MS use, as well as the kinds of amounts of health-related purchases they make for medication, equipment, supplies, home vehicle modification, and transportation. More importantly, today, Sarah will lead a discussion on the use of complementary and alternative medicine, or we call CAM, among individuals with MS. Sarah, the floor is yours.
Hi, everyone. It's very nice to see you here. I am just going to share my slides. Okay. So I don't know if any of you were part of the study that I will be referring to, but if you were, thank you very much. And also thank you for the questions you sent in advance. It's not very often that a speaker gets to know what people really want to talk about or hear about or learn about. But in this case, there were about 40 questions that came in. So I have a pretty good idea of what's on your minds, and you don't have to wait till the end when I finish speaking to ask your questions, because hopefully I'll be able to answer many of them as we go. I'm going to be compiling all the questions that we have, and actually a couple more came in today, and we'll send them off to our questions have power that Laura told you about, and maybe somebody will pick them up and study them as well. So some of the questions were very specific. Can I use this? Can I use that? Or what's the benefit or what's the harm of this or that CAM therapy? But in general, they fall into three groups: what helps, what harms, and how do I find out which is which? So I can't answer the first question except to say it depends on the therapy you want to use, or using, who you are, how you're using it, what else you're using. And I can't answer the second one except to say, talk to your conventional CAM providers on what harms, what helps. Do your own research using reliable scientific sources, and don't believe everything you hear or read. In the area of all healthcare, actually in the area of life, you have to be skeptical, ask questions, and use your common sense. But I can answer the last question about, how does this go down? Oops. No, that's not right. I'm Can you all see what I'm sharing well enough? I have my mouse both on my trackpad and my other mouse are not working very well. So I think I should do it this way. Can you see the main slide?
Yeah, I can see it.
Okay, I'll just push that over.
Yes,
and
ma'am.
Okay, good. So I can answer that last question. How do I find out? And I can do it in a few different ways. One is I can tell you about the online survey that Holly and I worked on and share some of the results of the survey that was taken by 361 members of iConquer-MS. And you may see yourselves in that survey, whether you were part of it or not, but it may answer some of the questions you have. I will give you two excellent and reliable sources of CAM information, one for people in general and one for people with MS. And then at the end, we'll talk about the most effective and safest ways to use CAM therapies. So starting with the survey, we wanted to answer the questions that I have here. What percentage of the participants in the survey used any CAM providers, practices, or products, or particular ones? And what were their reasons for doing so? We actually looked at use before COVID in 2019 and during the pandemic in 2020, but that's very complicated, and I'm just going to talk about what we found for 2020. The differences were not that large that it makes much of a difference for what we all need to know. We also wanted to know, how often did participants use these therapies? How much should they cost the person using them? How much should insurance contribute to the cost? And how helpful did people think the therapies were? And finally, did participants talk to their conventional providers about their CAM use? And if they didn't, why not? That's been one of the biggest questions that has come up in CAM research. So just a quick run through of what we found about using CAM in general. 60% of the 361 participants saw a CAM provider, used a CAM practice, or bought a CAM product. So for the CAM providers, about 46% saw some type of CAM provider. And in the table below are the percentages of the whole sample who saw particular providers. You can see massage therapists top the list, followed by yoga teachers, then chiropractors, and going down the list of particular CAM providers. I'll give you a second to just look at that. Oops, sorry, this mouse. I'm sorry. So practices, providers you pay for, practices you don't unless you purchase a yoga mat, but you're not paying for the yoga teacher. You're just perhaps paying for a, online video program using yoga, but you're not paying a provider, meeting with a provider. So that's the difference between a practice and a provider. 68% of participants use some type of practice, and here is what they used in the order of the highest number of people using them. So brain training, cognitive exercises, meditation, yoga, deep breathing, mindfulness, diets, relaxation. I'll give you a minute to look down the rest of the list. Purchases are what you purchase that you take on your own. You may see a therapist, so you could see a vitamin therapist or an herbal therapist, but you don't necessarily need to. And this is what people purchased in terms of vitamins and minerals, supplements, and herbs. Almost everybody used a vitamin or mineral. Well, I'm talking about almost everybody in this survey. Almost everybody saw a conventional provider, mostly a physician, also nursing professionals and rehabilitation and mental health professionals. So why did people use particular CAM providers? Just over a half saw a yoga teacher because they believed the teacher focused on the whole person. The same was true for acupuncturists. But if you look down the list of reasons that the provider focuses on the whole person, that the therapy is natural, that people had been using this before they even had their conventional provider, that the provider treats the underlying cause and not just symptoms, and because conventional treatments were not working. So you can see that people had different reasons for seeing different kinds of providers. I've highlighted the highest percentage of people giving the reason for across the 4 different providers. So we also looked at how often visits were made, practices practiced, purchases purchased, how much they cost, whether there was insurance coverage, and how people felt that they were helpful. It all depends. It's very detailed information because it depends on the type of provider and practice and purchase, and such things as a provider in Boston is likely to be more expensive than a provider in the middle of the country. If a product's on sale, it's going to be cheaper than something that isn't. But the ballpark figures are interesting. About half of the people saw their massage therapists, chiropractors, and acupuncturists 2 to 10 times a year, and much more often for yoga teachers. people made purchases and practices way more than that. Mainly because they can do it at home, they don't have to go anywhere, and it's also less expensive. The costs are very hard to generalize. I couldn't possibly explain it at this point, but some costs were very, very high. Insurance coverage was very, very minimal. And the perceived helpfulness, whether people thought it was very helpful or somewhat helpful, everybody thought one or the other, and mostly very helpful. Somebody asked the question, what are the requirements to have Medicare or private insurance cover CAM services? It all depends on the plan, on the service. So before you start using something, a provider or a product, you really do need to call your insurance provider. So now I'm turning to the two resources that we used in our study and also that I use whenever questions come up. So for anyone, the best resource available is the National Center for Complementary and Integrative Health website. It's one of the NIH institutes. They conduct intramural and fund extramural research. They provide answers to questions. You can put in the search bar, how effective is melatonin? And you'll get a huge list of studies and research on melatonin. And if there is no research or the research isn't very good, they will tell you that. So it's a terrific resource, and it should be the first place anyone goes if they are using or want to use some sort of CAM therapy. Two things I wanted to point out. Don't be turned off by this for healthcare professionals. There's nothing in there that anybody wouldn't understand. It really, given iConquer-MS's approach to research and healthcare, it shouldn't be there. You are all as professional as anybody needs to be to understand what's in that section in particular. And the same is true for Know the Science. Don't shy away from that. For people with MS who want to use CAM, the very best resource is the evidence-based guideline on CAM in MS, published in Neurology in 2014 by Yadav and a number of colleagues who are experts in the area. They addressed many of the same questions that you all asked. Do CAM therapies reduce symptoms, prevent relapses or disability? Do they have serious adverse effects? Do they interfere with disease-modifying therapies? So it also, there is there's the publication itself. There are online additional appendices. There's a brief summary. It's very easy to read and accessible and is a wealth of information. But there are a few things you need to know about guidelines, any guidelines. I don't know if anyone has ever looked at the guidelines for anything else about MS. And I didn't understand or know about any of this until I worked on a guideline. There's a team of experts who review all the research that's been published during a particular period of time, but from the beginning, usually up until the time the team starts. They make recommendations for treatment based on the scientific quality of the research. And if there is no research or no high quality research, there are no recommendations, except you should conduct more research in this area. I just wanted to show you what this classification system is like. So when you go to any guideline, I mean, there's guidelines on use of disease modifying therapies, symptomatic therapies in an MS, CAM. In the online appendices, this is what you will see. This is a little edited. So to classify the evidence, it goes from class 1 down to class 4. Briefly, class 1 is the best kind of study. Class 4 is not a good study at all on which to base a treatment recommendations. So those are Roman numerals, and letters are in the same way. And A is, it's basically the research is received an A because it has 2 class 1 studies supporting it. And it may, the recommendation could be, this is established as effective. This is established as ineffective. This is established as useful. This is established as not useful. It's established that this is harmful. So it's very clear and very rigorous. And U means, I guess, unknown. I don't realize I don't know exactly what it means, but basically it means there are no data that would support a treatment recommendation. So it's really important to recognize a couple of things. People may be on treatments and therapies. So for example, when we were doing the guideline for mood disorders, there were really not enough good studies on use of particular kinds of antidepressants to make a recommendation about treatment. But as you know, millions of people take antidepressants. So it doesn't mean it's not a clinically good thing to do if you're depressed, to take to follow a physician's recommendation for an antidepressant, but it means the research is not adequate or there is conflict among the different studies. So what is the most effective and safest way to use CAM therapies? It's kind of like that joke about how do I get to Carnegie Hall, you know, practice, practice, practice. This is research, research, research. Somebody sent in a question that said it can be difficult to suss out what is legitimate information, and that is so true, so true. The 2 resources I gave you are terrific, but the most important sources of information for you, any individual person, are your healthcare providers, whether they're conventional or CAM care providers, because they know you as the person you are. They know the health problems you have. They know what other conventional medications and CAM products you're using or want to use, so they can tell you whether there are serious side effects that could arise from interactions among the medications and products. And they can provide the kind of monitoring you need to have a good outcome and avoid adverse reactions. CAM products, many of them are potent, as potent as pharmaceutical products. St. John's wort, for example, which is used for anxiety or depression, is a very powerful herb. So it's not good enough or safe enough to say, oh, it won't hurt me. Too much melatonin can really cause people problems. So it's so important that people talk to their providers. And if their providers don't know, it's between you and your provider to figure out how both of you can become better informed. So it's a huge problem that people don't talk to their conventional providers about CAM. Only about half of the survey participants told all their providers about their CAM use. It's actually kind of alarming, particularly since this is what conventional clinicians like myself have always been concerned about, that people aren't telling us what they're taking. Now, that's not to say we don't have responsibility, and I'll show you the next slide, to ask about what people are taking, but the conversations just don't happen. And it's alarming because it hasn't changed over the years. I expected to see that many more people were talking with their conventional providers about their CAM use than had been doing the same thing 20 years ago. But it really hasn't changed. So you can see that the numbers of people talking is very small, and also alarming. Look at the number of people who didn't even have conventional providers. So the reasons that our survey people gave us for not talking with their conventional providers were essentially two. They didn't think the provider needed to know, and the provider did not ask. So that's the responsibility for, on the provider's side, the providers need to ask. And again, when we first started this study, we expected things to be better than this because CAM therapies have been not just around, but flourishing over the past several decades, but providers still aren't asking. And people in their patient roles didn't think the providers needed to know. We didn't ask, did you so I'm thinking about how to phrase this. So while providers need to ask, patients need to tell, and both of them need to understand how important the transfer of this information is, for the reasons I said earlier, that a lot of problems can occur as a result of not having this level of communication. I'll give you a second to look at it. So, how do people talk with conventional providers about their CAM use? There were two terrific questions that came in. What's a good way to start the conversation, even if, or especially if, you think the provider is going to be skeptical? And what do you do if your healthcare provider is judgmental, critical, dismissive? Do you just not say anything further? In addition to the survey, we did in-depth interviews with 20 people who had taken the survey. And there were several people who said, I fired my neurologist because my neurologist didn't care about and was disrespectful about my use of CAM. And I found a new neurologist who really gets that I want to be using whatever the various things that the person was using. So what I'd like to do now is open up a dialogue, because you've all been there. I'm sure you've all had situations like this. And it's not only about CAM. How do you talk with your provider about something the provider may not be interested in, or that you assume they're not interested in because they haven't asked, although they might be? How do you respond to a provider who says, I don't know anything about this, or a provider, even worse, who's dismissive and disrespectful about it? So I'm going to end the slideshow, and I hope we can just talk about all this.
All right. Thank you so much, Sarah, for really for the information. It's really informative, in fact. So at this point, I kind of like to ask if any participant have any questions or any kind of conversation that you like to make with Sarah, Dr. Minden. Please. Otherwise, I can start. Normally, the first one is the tough one. That is why maybe I should start. So, and I'm sure that somebody gonna, have some question later on. So, Sarah, one of the question, I don't know if you are, if you aware of any study about CAM and disability progression in the secondary progressive MS. Are you aware of any study?
No, but that doesn't mean there aren't any. That's why the guideline is so important, and researching the literature is so important, because our study was really was not focused on using particular therapies for particular problems, whether symptoms, disability progression, and that sort of thing, because that's something that needs a clinical trial. This was a survey of what people do and how they do it and why they do it. But you need a really, you could see from those Roman numerals that you can't make a recommendation for treatment until you've done a really good clinical trial, like the trials that have been done over the years for disease-modifying therapies. Again, because these are potent pharmaceutical entities, you have to be very careful about making recommendations. I'm sure even things like you should get a personal trainer. Well, if the personal trainer isn't familiar with MS and isn't sensitive to the kinds of exercises someone should be doing, you could injure yourself. So it really, I guess in a way, there's a paradox that CAM therapies have been taken too seriously and not seriously enough. There's a real paradox about this area.
Yep. Thank you. So I see two hands here. So Lola?
Yeah, Sarah, Dr. Minden, I know Sarah on a personal
Sarah,
level.
it's fine.
Comprehensive,
Anybody
so
should call me Sarah.
she's my favorite Sarah with an H. You threw out a question there at the end about leaving providers, and I want to know, as a professional yourself and you see patients, is it important when we leave a provider for differences like this that we explain our departure, or is it just okay to disappear into the woodwork and never be seen again? Because I have fired a provider and it's not comfortable, but I did tell them why.
Yeah, because, you know, in the CAM area in particular, or in, I guess, for any reason, the provider may be terrific for some things and not so good for other things. And to, like any relationship, you need the big picture about who the person is, what the relationship is like, and is it working for you? Because, you know, unlike, well, you're choosing the provider, choosing to stay with or use the provider. So to be able to speak your mind and to say what you think is very empowering and enhancing. I mean, yes, it would be good to educate providers about this. A provider who hasn't been helpful in a particular area should know that. But people, when they are in their patient roles, which we all are at some point, need to feel empowered to say what they want, what they don't want, what's helpful, what's not helpful. It's a self-respect thing, as much as anything. I mean, did you find that, Laura, when you said that, when you told your provider why you were leaving?
I did. I felt very good about it because I was able to articulate. I did it in writing, not verbally, but I was able to list all the reasons and where I felt my care was not sufficient and why I was going elsewhere. So I felt that was really important. That was about the time that I was going through the diagnosis process. So I fired a PCP and got a wonderful one who has been with me ever since. So there's always good things to it. I just thought from you being a medical professional, you know, because I think a lot of people hesitate to speak up and say, but wait a minute, particularly when it comes to complementary and alternative medicine use. I would imagine with like medical marijuana, that would be a really difficult, contentious conversation to have with someone who doesn't believe in the value of it. So that's just me. But thanks for answering that, Sarah.
Well, you know, I'm the kind of psychiatrist that's called consultation and liaison psychiatrist, which is the kind of psychiatrist who works with patients, families, and care providers, consulting to a treatment team and liaisoning with each person and helping liaison among people, you know, because especially with a condition like MS, there's a lot of people involved in your care. And so I spend a lot of time with people who say, I can't stand my doctor. I can't stand my physical therapist. And as we talk it through, often there's been some specific thing that occurred. And once that is spoken about, not only is it empowering, pretty often people say they work it out. And not always, and sometimes it's impossible, but sometimes it gets worked out and the care is all that much better because now you have the patient driving the care. You know, the patient ultimately is in charge of their own care. Two terrific books on that by Jerry Groopman called How Doctors Think and Atul Gawande called Complications. Take-home messages: you need to be in charge of your own care. So especially with a chronic condition, because you're in for the long haul and so is your doctor. So
Yep.
good for you, Laura, for speaking up and leaving if it's not working.
Yep. Thanks, Lola and Sarah. I see hand from Rich. Rich, you have questions?
Yes. Hello. I'll call you Sarah. It's hard to call.
Please.
Hard for me to say doctor. To not call you a doctor. But Laura, you just brought up an interesting point. I wouldn't say I fired a neurologist in the past, but I switched. This was a long, long time ago when I first got diagnosed. And it was kind of old school. And a couple of friends of mine pointed out to me that, Rich, you don't seem to be getting better with the treatment you're on. And I know your doctor is kind of old school. Might be time to switch. So I did. And I was honest with him. And my next visit, I went in and talked to him. And he was very appreciative of my thoughts. And I switched. And he actually wrote me a nice letter afterwards saying that, usually when a person leaves my practice, they just disappear. And he really appreciated the fact that I talked to him about it. So
Great.
that food for thought there. But my second point on the CAM is I go in armed with data to the teeth on why I should be doing this, that, or the other thing. And it's my job to be my best advocate because I'm the person suffering from the condition. And I haven't gotten denied anything I wanted yet. I think because I've gone in with that data and been able to convince them.
And for you to feel safe yourself.
Yes. Yep.
Yeah.
I always say if I have the 9 o'clock appointment, I'm the person that makes everybody late for the rest of the day. They allot 15-minute intervals, and I'm lucky to have doctors who will spend all the time in the world they need with me. So just food for thought there. But yeah, just go in, like I said, just go in, research what you want, and present it, because you're your own best advocate.
Right. You wouldn't buy a new car without checking it out, and you wouldn't, hire a contractor to put on a new roof without checking it out and checking out the kind of roof you want.
Yep.
So much more important is your own health and safety.
Yep. So thank you.
Thank you.
Thank you, Rich. Any other questions from the participants? We have time, in fact.
I'd like to ask a question. Sarah, can you comment on just the amount of research that happens for CAM, either CAM in general or CAM in the context of MS? There's a lot of drug trials that happen, and those are funded by companies who have a financial interest in seeing their drug be proved effective for MS, and then they can sell it. But with CAM, there might not be that, financial interest to conduct a solid trial. So do you feel that that gets in the way of having the evidence that we need, that people are looking for to make decisions? Or, are there other funders of that type of research? Any comments that you'd like to make about sort of the amount of research that's happening to answer these questions that so many people have?
It's a really important question. And, I call it the CAM Institute because I get the letters all mixed up, the I and the H and the C's, was set up because there wasn't research going on. And, there's a ton of stuff out there. I mean, if you Google anything in the CAM domain, turmeric, melatonin, the list of products that I listed, you get a ton of stuff. Most of it's people's experience. If you put in Google Scholar, say, or if you go to, a library website, you'll get published studies, but they're not great. They're small populations. They're not rigorously controlled. I'm sure for the same reasons, Holly, that there's no There's no money in it for anybody. I mean, it would be as if all drugs were generic, because these are generic products. You know, nobody owns them and can make a profit, you know, can sell them other than, you know, in your local herb and vitamin store. And, you know, probably most of the stuff is quite harmless, but some of it isn't, both for particular people and for particular products. You know, I haven't recently looked at the website of the CAM Institute. There are always studies going on there, but they're pretty small. Because who's going to fund them? Even, you know, I would think interactions with things, but you know how package inserts are listed. You know, they say we don't know the interaction with you know, these with herbs and vitamins. So I'm not optimistic about there being research. I mean, I think there's enough. No, if you look at the clinical guideline on MS, and it's now 8 years old, they were very careful about what they said. And even if you just read the abstract, you know, maybe this would help, but we don't really know. Because particularly in MS, where your sample, your research sample is so diverse, you know, people with different types of MS, you know, relapsing, remitting versus, you know, secondary progressive are going to respond to anything differently. People of different age groups, different types of symptoms, different mixtures of symptoms. You know, it's really hard to do a really good study. But if you're careful about what is known and thoughtful and have a provider working with you, then you're okay. One of, you know, we talked about harms coming from drug and product interactions. Some of the biggest harm is the cost of these things. Special diets that cost, you know, tens of thousands of dollars. You know, these total body assessments and all these things in your blood and all of that costs thousands of dollars. You know, people can be very badly harmed by that kind of thing. And some people were spending astronomical amounts of money in our study.
Yep. I think we have time, we still have time for a couple of questions, in fact, for those who type in chat. So Helen, actually, somebody gotta help me because there's an acronym there. So she mentioned that you know, her friend became a certified EFT. I'm not sure what that is, but EFT therapist, and then, you know, she which is based on the acupressure. So she tried that and seemed like you know, her leg kind of got better and so on. So her question is, if you actually can comment on the EFT taping, you know, what is it? And I guess that is exactly the same question as I have. So what is it, and does it work for stress? Have you heard about that at all? EFT?
I may have heard about it if I had the full name, but I don't know. If someone wants to just Google EFT, and I thought
tried,
that
in
kinds of
fact.
stocks or something.
Yep. I tried, but I couldn't. So, well, anyway, so let
You
me.
know, one of the biggest problems is one person can have a good response means nothing about the response of the next person. So You
Yep.
know, one has to be very careful, and people are very well-meaning. It's like, try this because it helped me. They're being generous and trying to help. But oftentimes, if you read the label of what it is that they're showing you, there's a lot of emotional freedom technique. Thank you, Laura. I do not know what that is. So I'm sorry to say I can't. But you know where you can find out? Go to the CAM Institute, plug it in, and I would imagine they have something on it. They also have like a weekly newsletter that you can sign up for that has the latest research on something. So
Yep. Yep. I'm kind of scanned through any other questions. I hope I don't miss anything here.
Chad, I did have a question. I did have a
Please,
question for
please.
Sarah. Do you have any other CAM studies planned in the future or anything that you're going to be using the iConquer MS community again for?
well, the study we did had several components to it. So the issue is writing up all the data. We looked at 3 databases, the VA database, a big claimed database, you know, millions of covered lives, and the SLIFCA database. We did this survey. We also did in-depth interviews of patients, providers, policymakers, and insurers. So it had all those components that need to be, we completed it, but now we need to write it up.
Yep. Yep. I think we still have time for one question. Anita, I see your hand. Anita?
Actually, it's not Anita, it's Tom. I'm using
Oh.
her computer.
Okay, that's fine, Tom.
I was just wondering what kind of studies may be ongoing, or if you know of any plans for studies regarding medical cannabis.
Oh, boy. Actually, that is one area where there is a fair amount of research. Look on the CAM Institute. That, can we put the link in the chat, or if you just,
We
if you
did.
just-
Yep.
oh, good, good. Look there, because there is study, because one of the providers we interviewed, we included her specifically because she's an expert in using cannabis for cancer patients. But it turns out that people with MS are actually the biggest users of cannabis, more than cancer, where it started. So it would actually be an excellent study, but it has to be done well. You know, it needs a lot of people. It needs to be done as well as a study of a new disease modifying therapy. Because there's, you know, if you look at the literature on cannabis, you would never use it, you know, your brain, your heart, everything else is severely damaged. So that's one set of studies. Another set of studies, you would, you know, do everything you could to get it because it helps everything.
That's true.
So it really needs a serious look. You know, but like Holly brought up, so what? You know, who's going to benefit really from a study like that? You know?
Yep. Yep. Well, as usual, when we have a good conversation, you know, our time is up. So right now I see that it's 5 o'clock Eastern time. So I kind of like to take this opportunity to thank Dr. Sarah Minden for her information presentation and also conversation today. And thank you to all of you for being here. Just kind of like to remind Sarah Lau just posted the survey for this presentation, and if you can actually give us your feedback we would really appreciate it. And just again, another reminder is we actually record this session, so we'll make it available. And I believe that it's going to be available on the iConcur MS website. And last but not least, our next chat with Chad will be on November 10. And again, at the 4 o'clock Eastern time. We haven't determined the topic yet, but we will have actually a speaker calling from Australia. So that would be, so please follow our iConcur MS social media and website for more details. Again, thank you so much, everyone, and you all have a great evening. Thank you.
Thank you from me too.
Bye.